Hello viewers. In today's episode we are going to discuss about the common test for abdominal pain, that is stomach pain. In the previous episode I have discussed regarding the common causes, reasons why this abdominal pain is happening or why this abdominal pain can happen. So if you are having abdominal pain, so definitely do watch the previous episode. You will get the reason for your abdominal pain and the other common causes of abdominal pain in the other areas also for your wide knowledge. In this episode I am going to tell you the common test we do if a person comes with abdominal pain and the reason why we do those tests also. I am going to tell it out frankly in this video because all of you should be aware of why we are doing the investigation also. Sometimes we ask you to do some investigation and at that time people refuse, saying that they don't want the investigation, they just need medicines. So it's simple, or maybe it's sometimes it becomes difficult for a doctor to just give you medicines because we do not know exactly what is the reason for the stomach pain or abdominal pain. To get to know the reason, we need to have some basic clue that this could be the reason for abdominal pain. Then only we can give you medicines accordingly, because there are so many reasons why there can be pain in your stomach. So in this episode I am going to tell you the common investigations which we do and why we do those investigations, so that you get to know the reason what we are thinking in the back of our mind. So commonly we'll start with the blood tests. Usually the blood test, if we are coming, we usually do the complete blood count or the hemogram. So in that, if we take the hemoglobin, if we want to focus hemoglobin is something which we deal with anemia. All of us know if you are having anemia, your hemoglobin will be low. The importance of hemoglobin in a person with stomach pain. Suppose a person is having peptic ulcer, any ulcer in the stomach, or because of any cancer, or because of any esophageal erosions or esophageal thickening, then that time the person can have anemia. So hemoglobin can give a clue that these can be problems in the stomach. The next thing is total count, WBC count. Suppose a person is having any infections like say appendicitis, pancreatitis, or say mesenteric adenitis, cholecystitis, pyelonephritis. All these conditions can cause high total count. So that high total count can give us a clue that some infection is going on in the stomach. So in that way total count helps us in the diagnosis of infections. So the next thing, ESR, erythrocyte sedimentation rate. So ESR can be high in many conditions, like for example cancer, Crohn's disease, any infections in the body. So basically we do not take ESR much into consideration. These days we take CRP, C-reactive protein, as a better marker in situations where we expect any infection or any inflammation, because CRP is a very good marker for infection and inflammation. The next thing is peripheral blood smear. Peripheral blood smear very rare, but we use it to diagnose if we are suspecting some sickle cell anemia. So if we are suspecting sickle cell anemia, peripheral blood smear is what we prefer for. Next, coming on to the liver function test, the LFT. Under the liver function test there are so many tests. So if we are suspecting any problem with the liver or the gallbladder or that hepatobiliary system is what we say, if we are suspecting any problem with that, we will order or we will request for a LFT also. The next thing coming is amylase and lipase. These amylase and lipase are pancreatic enzymes basically is what we say. If these enzymes rise to more than 3 times the normal value, then there is more chances for pancreatitis to be there. But this enzyme can also be elevated in many other conditions in the stomach. For example, if there is any perforation, if there was an ulcer and that ulcer got burst and it became perforated, then also this enzyme can be high. So suppose the empyema has ruptured. Empyema means any abscess in the gallbladder. If the gallbladder is having any pus and that pus is broken and it comes out into the abdomen, if that happens, then also there can be chances of elevated amylase and lipase. The next thing is abdominal aorta aneurysm. If that aneurysm also ruptures, then also there can be high chances of amylase and lipase in the blood. And the next chance is ruptured ectopic pregnancy. If there is ectopic pregnancy in females, if that gets ruptured, then also these enzymes can be elevated. The next thing which we do is probably a renal function test. Suppose people, if we suspect any kidney disease or uremia, then also these few people can get abdominal pain. Then RFT also we do. The next thing is in females particularly, if they are having any abdominal pain and they have not got their menses properly on time, then we have to do a pregnancy test. That is to look for any ectopic pregnancies, because ectopic pregnancies can cause huge pain in the stomach, and females can present with abdominal pain. So that is one cause of abdominal pain in females. The next thing is, as I already told you, for ulcer we do the H. pylori testing, Helicobacter pylori testing. So that testing can also be done. It's not directly like a blood test. We basically do it by ultrasound, I mean to endoscopy. We put an endoscopy and then we see the stomach, and suppose there is any ulcer, we take a tissue from that and we check for the H. pylori. So that is one option. The next thing is coming to urine. We do urine test to check for if there is any blood cells in the urine. What is the significance? It can be because of any infection. Blood can come in the urine because of any infection, or even because of any stones, because from the kidney through the ureter, if there is any stone, that stone can cause any irritation in the ureter or in the bladder, then that can cause some blood in the urine. So urine test if we are doing, if there is blood, then this is the significance. Next comes is WBC, pus cells in the urine. If pus cells are more in the urine, then there can be chances of any infections. Then the next thing is bile pigments. If there is any gallbladder problem, then there can be some bile pigments. Next is porphobilinogen, that is in case of porphyria. Next is ketones. Suppose we already told you in the previous episode, diabetic ketoacidosis, DKA in diabetes can also cause abdominal pain. Suppose urine ketones is positive and the sugar levels are very high, then there is chances of diabetic ketoacidosis also. So the next coming test is stool. Sometimes we also test the stool. So what is the importance of stool testing? If there is any blood in the stool, then it signifies that there can be some reason for infection in the stomach, or the mesenteric artery. There is one artery called the mesenteric artery which is supplying blood majority to the intestine. So if that is obstructed, or that is occluded, that is blocked, then also there can be blood in the stools. In cases of intussusception, for particularly it happens in children, that is the intestine, one part of the intestine goes into the other part of the intestine. So if that happens, then also there can be blood. That they basically say it as red currant jelly stools, because the blood will be very fresh, it will be very jelly kind of thing. So that is what they say, red currant jelly stools in intussusception. Next is because of any colon cancer or any diverticulitis or Crohn's disease, ulcerative colitis, etc. There are many other disorders why there can be blood in the stools. Suppose there is any WBC or pus cells in the stools, then there is more chances that there is some infection in the stomach. So now I have told you the basic test, that is blood test, urine test and stool test, which is related to the stomach. Next, coming on to the scans. What are the different scans which are available for testing the abdomen, and what is their importance? Under the scan, that is the radiology part, the first thing which we will discuss is X-ray, next is ultrasound, next is CT, next is MRI and other imaging studies. First, coming on to the X-ray abdomen. Suppose we are ordering an X-ray abdomen. What are the things we are suspecting to find in an X-ray abdomen? The most common thing which we want an X-ray abdomen is to pick up for kidney stones or ureteric stones, because 70% of the stones can be picked up on kidney and ureter in the abdomen X-ray. The next thing is gallstones. Less than 30% of the cases gallstones are visible, so that can also be picked up. Suppose there is any air blocked in the stomach, or because of any gas distension or any organ got twisted. So all those reasons can also cause abdominal pain. So in that situations also we take abdominal X-ray because we can see gas in the stomach. So these are the reasons why we take stomach X-ray. Sometimes there can be any bowel obstruction, that is your intestine can get blocked. If that intestine is blocked, then in the X-ray itself you can see multiple air fluid levels. So because of that also we take abdomen X-ray. Next thing is coming on to the X-ray chest. X-ray chest, what we are worried of is, suppose there is any perforation, there is any leak of air from your stomach or from your intestine, that air can go up and fill in your upper part of the abdomen, that is below the chest. Suppose we are taking a chest X-ray, the down part below the lungs, there can be some air collection which can help us to identify if this is because of any ulcer or perforation in the stomach. That is the importance of X-ray of the chest. So next coming on is the ultrasound of the abdomen. In the ultrasound of the abdomen, we can find out very basic things we can find out in ultrasound of the abdomen. That is problems related to the liver, problems related to the gallbladder, related to the ureter, kidney, pelvis, all these organs, bladder, all these problems we can find out. But ultrasound has a limited role because of the probe, the depth of penetration of the rays through the stomach, and the machine quality of the machine, interpretation of the doctor, all these play a role in ultrasound abdomen. So the better test for the further testing would be CT scan of the abdomen. In the CT scan of the abdomen, all the organs we can see very clearly. We can zoom and see in the images which we are getting, and we can also find out any masses or any even small growths or fluid collections in the abdomen. The next upper test is MRI abdomen, that we do very rarely. That is for other cases like any cancer patient, we are finding very minute soft tissue problems, things like that, we do this MRI testing. Otherwise most of the problems in CT abdomen itself, it can be picked up. Next coming on to the pancreatic problems and the bile duct problems, for that we do various tests like ERCP, MRCP and all those things, and there are also nuclear scans to test for cholecystitis and things like that. So in this video I have told you the basic tests which are required for testing in a person with abdominal pain. Basically blood test we do, little urine test, stool test and scans if necessary. Whatever is necessary, whatever doubt we have in our mind is what we think, and we do these tests so that we also get a rough idea or a close idea of what problem you are suffering from. I hope this video will be helpful to you, and it will make you more aware of why we are doing these tests in our daily practice, so that it helps us and it will help you also to recover soon. I hope this video is helpful to you. Please do not forget to subscribe to our channel, click on the notification bell for regular updates, and do ask your questions in the comment section. Stay healthy. God bless you.